Good evening, everybody. Good evening, Ibs.
Good evening.
I was just noticing here, this is our 89th webinar.
Wow,
That's a lot, isn't it, over the years?
that is a lot, yeah.
Welcome, everybody. Come on in. And we're delighted to have you this evening. I know there's a lot of other webinars, meetings, and things like that on this evening. So we're delighted to have you here. And Ibs has a brilliant presentation ready for you. So we'll just give it a couple of minutes to let everybody in, and then I will just go through how to get your CPD certificate. So yes, 89 webinars over the last 5 years.
That's a lot of webinars. No coincidence that I was born in 1989 there.
Yeah, we started up, well, 2020, really, when nobody knew anything about Zoom very much.
No, and then we all found out very quickly, didn't we?
Very quickly, yeah.
Yeah.
So are you Zoom or Teams?
A combination of both, actually, but I am growing a little bit more onto Teams now. Apart from the one time the whole of Microsoft went down when we had a webinar, and that wasn't great. But we had to move on to Zoom. But yeah, Teams works pretty well.
Yeah, I'm a bit of a Zoomer, I must say.
Yeah.
So, good evening, everybody, and we're delighted to have you here this evening with Ibrahim Newman, who is going to tell us all about how to look after composites and his journey. And at the end of the webinar, Ibs will put up a slide that will have a QR code to go straight through to get your certificate. You answer a few questions and your certificate will land in the inbox. Please just check your other email, like your spam and junk and so on, because you know the way emails can disappear into those and the certificate should be there. If it isn't there, I'm going to put an email address into the chat box and you can just email me and we'll sort that out for you because everything is documented when you go through and answer the questions. So, Ibs, I'm going to hand straight over to you and let you share the screen. We'll
Thank
have
you.
questions and answers at the end. If you could just put them into the questions and answers, that would be really helpful. And then we just have one stream to keep an eye on, and then you can chat in the chat if you want.
Perfect. Are we good to go, Shwam?
We are good to go. Thanks, Ibs.
Brilliant. Thank you very much. Welcome, everybody. Thank you so much for joining me on a Thursday evening to discuss composite care and the key to longevity and effectiveness. So, a little introduction on myself. I graduated from the Eastman Dental Hospital in 2019 as a dental therapist and worked across private practices in London and Brighton over the last 6 years, carrying out my full scope. I have a special obsession with composites and have been doing a lot of composite smile makeovers and composite edge bonding over the last few years and helping maintain those as well, which we'll get into in just a moment. In my spare time, I am with a phenomenal team, NSK Ikigai clinical educator, also do some clinical education for dentinal tubules and part of the BADT Executive Council. And recently, the hardest job of all, I'm now a father. So I'm looking after a baby boy that is keeping me very busy amongst everything else. So what is our aim? It's to highlight the essential care and maintenance needed for composite bonding to ensure the longevity and effectiveness. We are going to cover the practical tips for maintaining composite bonding, including brushing techniques, OHI, foods to avoid, the importance of regular dental checkups, and how to manage composites as a dental care professional during your routine hygiene visits. This presentation is going to provide you with a deeper understanding of how to maintain and enhance professional practice, and hopefully you'll have a clear understanding on how to take care of composite bonding for a lasting, beautiful smile. Our objectives is to discuss the basics of composite bonding, learn what composite bonding actually is and how it's used to improve the appearance of the teeth, identify proper care techniques, understand the key oral hygiene advice and its importance for composite bonding patients, recognize the foods and the habits to avoid with our patients, and learn how to manage composite bonding during our oral health examinations as a dental therapist or our hygiene visits as a therapist or hygienist. So let's start off with the basics, shall we? What is composite resin? Composite resin is a tooth-colored material used in dentistry to restore the function and appearance of decayed or damaged teeth. It's made of a mixture of plastic and fine glass particles, which can be sculpted to match the natural contours of the teeth and polished to achieve smooth, aesthetically pleasing finish. Dental composites are favoured in their versatility and ability to bond directly to the tooth structure, providing strong, durable restorations used for fillings, composite veneers, and composite edge bonding. So what are the components? We have our matrix, our filler, coupling agent, initiators and accelerators, and our pigments. And I want to focus on our filler, okay? Because the durability of composite resin very much depends on two things, the filler content and the filler size, okay? So, for example, if we look at the smaller particles of filler size, they're more easily polished for aesthetic reasons. And the larger particles result in a harder to polish, rougher surface. And we'll go into what this means in just a moment. And the amount of filler that's in there, if there's low filler content, then that means that the strength against occlusal forces are not great. And if there's loads of filler content, then the surface hardness and compressive strength increases. Okay, so what does this mean? If we take sort of two composite brands that I use a lot of different composites depending on different cases that I do. But if, for example, we take Ivoclar Empress, which I sometimes use for my composites, I barely need to do any polishing whatsoever with that composite. It really, really shines, you know, just a couple of strokes with your soft flex and it really pops and shines. So that means that it has really quite a lot of smaller particles in there and it gives that really nice shine. Then if we look at Venus Pearl, for example, a composite that takes a lot more effort to polish, but once you do get there in the end with your polishing techniques that we'll go over towards the end of the presentation, you do get there, but it means that the filler sizes are a little larger. And also I found that with Empress I sometimes get some chips and breakages, which probably means that the filler content is quite low, whereas Venus, looking at the evidence, does have increased filler contents in there, so it's a harder surface and it's really good for occlusal forces. So depending on where you're placing these composites, what risk factors the patients present with, which we'll get into in a moment, may depend on the type of composite you'd like to use. So a little timeline here. We are going to geek out a little bit because I do have a science background, but I'll try keep you awake as best as I can. We started off in the 1960s and 70s with macrofill composites, which had a 10 to 50 micromillimeter filler size. And then as we move on through the decades, it changed to a mid-fill and a mini-fill. In the 80s and 90s is when hybrids were introduced with microfills and smaller particle composites. And it had different sort of sizes in there. So you could see here with the filler sizes, it was a range of smaller filler sizes and larger filler sizes and packed in all into one place. And it's gone from 10 to 50 micromillimeters to 0.01 to 5 micromillimeters. And as we move on along the years there and where we are now, we're now at the nano hybrid stage, where we get the best of both worlds is the idea. So as long as you know your polishing techniques down to a T and you follow the protocols correctly, you are going to get really strong, durable composites that also give a really aesthetically pleasing result. Okay, so a special shout out to the lovely Tracy Deal, part of the Ikigai team, who brought to my attention this study on resin-based composite materials and its sustainability. This is a study that was carried out in 2022. And I think it's very important for us to just very quickly gloss over this. It's really relevant. Lost my words there. I've done a lot of consultations today. Very relevant to why we need to be a lot more aware with our composites and ensure that we maintain them for a long time, because actually they're not that sustainable. So the study examines the environmental impacts of resin-based composites, materials used in dentistry, and it highlights the elution of monomers and microparticles from these materials that contributes to pollution. Okay, the elution of monomers and microparticles basically means the release, the leakage of these monomers and microparticles. So the chemical compounds that are present in resin bonded composites that may act as pollutants, the degradation process of the composites and if its environmental consequences, the methods for detecting and quantifying the monomer elution, leakage, and microparticles, and the strategies to reduce the pollution, including improved material design and waste management. So I just thought, instead of me going through this whole study for hours on end, which you won't thank me for, we'll just take the key points from it. So in comparison with dental amalgam, as we all know, has been discontinued around Europe now, and in the UK, I'm sure we will, I think the target is 2027, if I'm not wrong. We are going to be discontinuing amalgam as well. While dental amalgam has been phased down due to mercury concerns, composites are under some scrutiny for their own environmental footprint. Um, and the pollution potential is that they contain monomers and microparticles that can leach into the environment, potentially affecting the ecosystems. So the waste management strategies, and this is where we come in, is really, really important. How can we minimize the waste and improve material design to reduce pollution? The carbon footprint of dentistry as a whole is quite large, and it contributes significantly to carbon emissions, with travel and procurement being major factors. And I think we all need to be a little bit more aware, and I think the dental industry itself has a lot to answer for its carbon footprint, because we do use a lot of single-use items, obviously. And it's just a really important space to watch. So what can we do? Well, we need to ensure that there's minimum composite waste in the surgery. So if we are using any composite, let's just be aware of what it is we're using. What are we trying to repair? Are we using a really small amount of composite for a really small repair or a really small fill-in? Do we need to use the compules the composite comes in? Or could we just use the syringe of composite that we have and use a clean, sterile spatula to just get what we need out of that syringe, instead of using a single-use compule that you use a very small amount of and throw to waste in a plastic bag with a plastic dappen spot and our plastic aspirator tips and all the rest of it. So every little helps. Let's just be a little more aware of what we're doing. And this is the key one: well-maintained composites to ensure the longevity and minimize leakage. So what can we do as clinicians as part of placing the composites, as clinicians as part of maintaining those composites, and as clinicians in educating our patients on how to care for their composites? So watch this space. I'm sure there's going to be loads more changes coming, and I'm sure companies will make some further changes along the way. We looked at a significant change from the timeline that I showed you in the earlier slides, from the 1960s to now, how much things have changed. I'm sure it will continue to evolve and hopefully become more sustainable. So let's talk about the composite boom. The composite boom we refer to happened in about 2019, 2020, and it's very much related to, if you remember, that's when COVID was, and we were all dragged in front of our screens whether that was for work or for those dreaded family quizzes that we all did. In order to carry on with our lives, we were trying to connect with people through the computer screens, through our laptop screens and phone screens, and more people became aware of what their teeth looked like as they were looking at their own reflection on these Zoom meetings. So, I mean, composite smile makeovers has been around for years, and they were present in 2016, 2017. There was still a significant amount of composites being used. But it wasn't until 2019 to 2020 when the real boom happened, which was around the time that I graduated and went straight into do loads of courses on composite bonding myself. So it was a great time to practice because there was a lot of interest there. So the Great Battle, I very briefly want to touch on this. There is a lot of images on here of my patients, some videos of my patients, and also some before and after shots and all the rest of it. All consent is obtained. This is the lovely Saskia on the left-hand side that wanted glowing Hollywood smile, really big white teeth is what she was after. And it was really refreshing for me to see that she came asking for composite bonding. And the main reason for that is because although we sit here and moan about turkey teeth, and Katie is a lovely patient of ours at the dental health spa. I've personally never treated Katie, but we have some mutual friends and I see her kids. And she is well aware of what she's done. Now, unfortunately, some patients that come to see us are not so aware. They'll say, oh yeah, I've got veneers done in Turkey, and they're completely unaware that they've got full zirconia crowns, teeth shaved down to pegs. Katie is aware. She knows exactly what she's done. I'm not sure if she's aware of, with these images being shared in newspapers and the news even, and social media, how much of an effect she's had. But she has actually made people more conscious. I do have a lot of patients that come to see me and say, I want composites, I don't want my teeth shaved down. So that is one positive we can take from it. Unfortunately, we can't stop patients going to Turkey. The appeal is there, not only with lovely food and the nice weather, but also how quick everything is. And unfortunately, we're living in a generation and a society where everything has to be very quick. You know, patients come and see me. We recommend that they need this many hygiene visits, this many fill-ins. They need Invisalign maybe. They need a little bit of whitening. And time is valuable for them. And they'd much rather go Turkey. So we can't please everyone. Believe me, I've tried, I've begged. I've got a Turkish background and I work in dentistry and they still don't listen to me. But it is something that patients are being more aware of and choosing composite bonding over turkey teeth, which is a great thing. Because once composite bonding is there and it's had its time after 5 to 7 years, once we remove it, there is next to no damage to the teeth. So, responsibilities. I've decided to split this up into 3 phases. So we're going to speak about the responsibility of the clinician, whether that's the dentist or dental therapist placing the composite bonding, the patient's responsibility, and the maintenance side of things for the dental therapist or dental hygienist and how they can maintain these composites. So let's start off with the clinician. In terms of composite placement, there's a few things that we do at our consultation. So for example, this lovely patient, this is a case I did pretty recently, actually a couple of weeks ago now. Lovely lady came to see me, wanted a very natural smile, so we opted for that A1 shade finish, some tired fillings on those front teeth that we removed. And one of the key things that I say to all my patients when placing composites is margins. Okay, so if we look at the composites that I've placed here, you can see that they're roughly 1 millimeter below the gingival margin, and that is deliberate. In some areas where there's some abrasion, and in some areas where there's a little bit more recession, it's even more than that. And that is deliberate because composite and gingiva are not a match made in heaven. That is like a couple from Love Island or Maths. So sorry if you're a fan of those shows, but it's not going to last. It's not a great relationship. They clash. However nicely you place your composites and polish around the gingival margin, it will still be a plaque retentive factor around there. So to eliminate that, I now place my composites at least 1 millimeter below the gingival margin. Make sure it's a nice smooth transition and there's no ledges, so we polish it really well, and it allows the patient to still clean around that gingival margin very, very well. The next thing we need to assess is the interproximal contacts. So for example, when this patient came and told me what type of smile they wanted, at no point did they say that the spaces between their teeth or the black triangles in between their teeth concern them or bother them. So I am not going to close that black triangle up. I am going to leave it exactly there so the patient can still use the needed TPs or easy picks, whatever it is, to clean around that area. And you want to ensure that your contact points are nice and smooth so the patient can get floss in between there, has space to get some TPs to clean around the gums. We're adding something onto the tooth, so naturally it's still a plaque retentive factor that will contribute to more plaque stagnation and some food trappings. So you want to be able to ensure that they could clean around those areas very well. The next thing is that once you've placed your composites, you want to do a final cure with glycine. This is super duper important. Okay, so glycine, smother it all along your composites that you've just placed and light cure again for 20 to 30 seconds. The reason for that is it gives a final cure and sets the composite and really prevents the composites from staining badly in the first 2 weeks of placement. So the first 2 weeks of placement of composites is when your composite material is the most porous and can absorb the most stain. So we do a final polish appointment at least, well, minimum of 2 weeks, and then you do your final polish. But I sometimes send them away for 3-4 weeks and get them back in for a review to assess everything and go from there. The next thing we want to assess is our occlusion as well. So with your occlusion, how the teeth meet, not only are your teeth how they are biting together, but how the lateral guidance is with your lower jaw. Now, this is quite important for the longevity of the composites. So, for example, if you're working dentistry, you're very likely to have very flat canines because we're all very stressed all the time, right? But if you do have flat canines like this lovely patient did up here, it's very likely that when she bites down together like this and moves her jaw to one side, that she's contacting on more than one tooth when her jaw is to one side. So that means that she is in group function and wearing down more surfaces of more teeth. If you've got really nice pointy canines just along here, like we built up along here, and what you can't see is behind these teeth, we have what we call canine ramps, which encourage and take that load. And that's deliberate because canine guidance is ideal. Canines are designed to take that load when we're chewing during mastication. Our back teeth are not so good at taking that force. They're great at taking vertical forces, but they're not great at taking that. And that's because our canines have the longest roots in our mouth, and therefore it's really good at taking those lateral guidance forces. So you want to try and incorporate that. Please get a dentist involved whenever you're thinking about changing occlusion, and make sure you get their feedback and assistance all the way through. Diet advice. You need to make sure that your patients are aware of foods and drinks to avoid in the first 2 weeks of placement. But not only that, once they've had their composites placed, they need to be aware that they can't bite into apples or crunchy tuna baguettes from Pret, because it's likely that that force can chip the composites. Maintenance advice. What toothpaste are they using? Do we need to instruct them to use a different toothpaste, which we'll get into in just a moment? What oral hygiene tools do they use at the moment? Do we need to ensure that they are getting more hygiene visits before we even place these composites? They need their regular examinations and a review of the composites yearly. Whether they are seeing you for their examinations or seeing someone else, you should be reviewing their composites on a yearly basis to ensure that everything is still going okay. So, patients, what do they need to do? Okay, so this is lovely Joel on the right hand side, and he wanted the classic Hollywood smile. What did he need to do before we even got to that stage? Well, we needed to make sure that his oral hygiene was impeccable, because when you're placing composite bonding, my rule is fair OH is just not good enough. It needs to be perfect, because once that composite goes on, it becomes a little bit more complicated to clean around your teeth, and it attracts more plaque bacteria. So we need to ensure that you're cleaning around your teeth exceptionally well. Are they smoking? Are they vaping? If they are, they need to stop, or it's going to stain the composite really bad. Retainer compliance. A lot of the time we recommend retainers for patients if they are going to get some composite work and they are clenching or grinding their teeth. So you need to get a dentist involved with that, obviously. So if you see any evidence of flat canines, chipped teeth, worn down teeth, ask the patient, do you think you're grinding? Do you think you're clenching your teeth? Get the dentist involved and see, because the last thing you want to do is place these beautiful composites and they keep chipping them and grinding their teeth down and chipping these composites, which will cost you a lot of clinical time, and it's really not worth it. So a retainer may be recommended by the dentist, and make sure that the dentist prescribes that for you. Diet, and in brackets I've got GMPB. I have not copyrighted this, so feel free to use it, but I basically say to my patients, if it stains your glass, your mug, your plate, or your bowl, it's going to stain your teeth or your composite. Okay, so whether it's a glass of red wine, a mug of hot chocolate or coffee, a plate of curry, or a spag bowl, it's going to stain your teeth. So what do? Do you just have a white diet for the rest of your life, or do you advise patients to drink loads of water throughout the day, brush their teeth 30 minutes after they've eaten something that's likely to stain their teeth, and just get a bit of a background and understand that the patient needs to make a big sacrifice with their diet, with their oral hygiene routine, in order to maintain these composites and ensure that they last a long time. Habits, are they currently opening bottles or packets with their teeth? Because if they are, and then you're going to place composites, then again, that is a very expensive mistake that will cost you a lot of clinical time. Diet advice, ensure that you've gone through what we spoke about, especially the first 2 weeks of placement. Remember, we said how porous composite is in the first 2 weeks. Maintenance advice, it's a patient obviously informed of the toothpaste they should be using, like we just discussed, and the oral hygiene visits they need, and the oral hygiene instructions that you've given them after placement, and the commitment that the patient needs to make for regular examinations, because even though their teeth are covered up, they are still prone to gum disease, they are still prone to tooth decay, and they must still go ahead with the regular examinations and a yearly review with composites. So I give all my patients at the consultation appointment this maintenance form. And this maintenance form basically says exactly what we just discussed: how they should be looking after their teeth, how they need to be brushing their teeth, how their teeth can stain and how they can avoid it, avoiding chlorsidil and chlorhexidine-based mouthwashes, opening packets and bottles with their teeth and all the rest of it. You want to avoid that. And just how different the composite's going to feel, what I recommend in terms of how many hygiene appointments they may need, and that will be adjusted per patient, and how many checkups they may need, and that will be adjusted per patient. And they sign this on the day that we place the composites for them, so they have an understanding of the commitment from the very first time I met them at their consultation appointment. I give them this maintenance form, I give them a treatment plan with what they want, and a treatment plan of what they need to do before we could do what they want. And that's normally an examination, some x-rays, a number of hygiene visits to get the oral hygiene up to scratch, and possibly some teeth whitening. Okay, so I always get it in writing, not just trusting my patient's judgment on what we've discussed at the consultation appointment, where they're all very excited to get their teeth done. So maintenance appointment. So stating the obvious here, but for example, this lovely patient wanted her diastema closed and didn't want no length added to the teeth, didn't want the shape of her teeth changed, didn't want composite bonding anywhere else, just wanted diastema closed to keep it as natural as possible. Beforehand, grey TP in between there. Now we need to instruct the patient. I know it sounds obvious to us, but you're not going to get a grey TP in there. So maybe an orange easy pick and a little bit of floss around the contact points there to ensure that you're keeping those areas nice and clean. What toothpaste is the patient using? Well, here is a relative dentine abrasive table that I made of all the leading toothpaste brands that we could buy in the UK. I didn't go through every single one, but the most common ones that patients use. And basically, this is telling us how abrasive the toothpaste is. Green is good and red is very abrasive. Okay, so if we imagine that water and a toothbrush has an abrasiveness of 4, okay, and then we look at Sensodyne Pro Enamel, for example, which has an RDA value of 34. So that is not very abrasive. Why are we talking about dentine abrasiveness with composites? Well, enamel is the hardest substance in our body. Enamel is harder than bone. Composite is a great functional material that we could use to replace enamel and mold into beautiful shapes and designs and colors, but they're not as strong as enamel. So we're using our RDA values here to make sure that the patients are not brushing with very abrasive toothpaste that can scratch and damage the composites, attract more stain, brush away some enamel. If you've got some edge bonding, I'm sure you've all seen it before, but if you've got some edge bonding and the patient's using very abrasive toothpaste with a manual toothbrush and they brush away some of their enamel, all of a sudden that edge bonding sits very proud. They get loads of staining underneath the margin. That could lead to some caries underneath there. So you want to ensure that you cover all grounds here. So for example, if you said to me, I use Arm & Hammer Advanced White, I would think that that's a very abrasive toothpaste. Apparently it's not. Okay, only has an abrasive value, RDA value of 42. Colgate 2-in-1 whitening, very high, RDA value of 200. We want to avoid our patients that get any type of composite work. But in general, that's not what I want my patients to be using on their beautiful enamel teeth, regardless whether they have composites or not. So this is a table that I checked and cross-referenced recently, and it's still accurate, but please do know that it's approximate values and companies are constantly changing their toothpaste. I know Oral-B recently changed their toothpaste ingredients, so it's constantly changing. But this is currently what it sits at, just to give you a bit of an idea. So maintenance appointments. What are we doing at our maintenance appointments? Are we going to be using an ultrasonic and a polish? Are we going to be using air polish therapy? Are we going to be using polishing burrs? Well, the truth is you could use any of those things as long as I'm using them correctly. And a combination of all of those things at the same time, which is something that I do. So we're going to go through some polishing burrs and paste, and then I'm going to go into, I've got some videos of what I use in particular. So it's my way or the highway. This is what I use, what works for me. I've gone to loads, a ridiculous amount of composite courses, and I've kind of taken little nuggets from each one, and this is what works for me. But it's not to say that this is the only way to polish composites. You need to find what works for you and what works in your hands, and it's all about trial and error. So if we have a look at these Softlex discs, okay, they normally come in 4 different colors, and they should be used as a stage 1, stage 2, stage 3, stage 4 is how they're designed to be used. However, if you're using the coarse Softlex discs, which are the first 2 colors, the darker colors here, you are going to be removing some composite. So we are going to talk about these, but this is mainly if you're placing composite and you've got some excess to remove. And I very rarely use a very coarse one. I tend to use this one. But you want to make sure that you stick to these lighter colors of Softlex. Okay. If you're unsure, please feel free to reach out to me at any time. But speak to your dentist that may be or dental therapist that may have these and are currently using them, and make sure that you're using the correct Softlex disc size, and that they are not too coarse to remove any composite. So you want these lighter colored ones that will give everything a nice buffer. I also really like the enhanced points. These are sort of rubbery diamond encrusted points. Again, if you're using these for a long time, they heat up with the slow handpiece. So the Softlex disc also goes on a slow handpiece. And while they heat up, they can melt away some composite. So you can lose some anatomy in the tooth. So you don't want to start altering and changing how the composites look. You just want to buffer and shine them. And what's really handy to do that are these wheels. Again, these are called polishing wheels. Many different brands have them. You've got the ASAP ones, which come in a dark blue and a light blue. You've got the EV rotaries, which are a grey and a pink. You've got some polishing strips, which come in fine, medium, and coarse. So everything has a different level. So you need to ensure that you're using the safe ones with some polishing paste, which is not very abrasive at all. And there's loads of different ones on the market, enamelized being one. I absolutely love the Lucida polishing paste by Style Italiano, which I'll talk into in a little moment, and you can see how much of a difference that makes. But just make sure you're using the right burrs if you are, and if you're unsure, just ask. When I first started off with this, and I worked in my hygiene surgery, I realized that my drawers with my burr selection was empty, and then I went into the dentist surgery, and it was like I was a kid in a candy shop. They had all these different burrs and they told me what they used, and I was like, oh wow, okay. So explore, discuss with your colleagues, and use what's out there, but make sure you're doing it safely. And if you're unsure, like I said, please feel free to reach out to me anytime. So this is my setup for a yearly review for a patient that's had some composites placed. Or if a patient needs to have a polish, a separate polish. This is what I set up with for my birds. Okay, so these 2 syringes here are some composite polishing paste. I've put both out there, but I tend to use the Lucida most of the time. Let's go back there, jumping ahead. The Softlex discs, these 2 are the coarse ones, and these are the light ones, and they go onto your mandrel. This is your staffing, and you get this as part of the Lucida kit that you order from Style Italiano, and it comes with its burr and staffing to go on there. And these are your enhanced points that you could use, or rubber discs, whatever you prefer, and your polishing wheels, which are all diamond encrusted. Okay, so let's have a look and see how we actually use these. Okay, so this is my lovely nurse. Well, used to be my lovely nurse. She's now moved to Australia, and she very kindly volunteered for us to film on how we buffer her composite veneers. Okay, so notice a few things. First and foremost, I'm using the yellow Softlex, okay, which means that I'm not removing any composite. So if you see a patient that has not a lot of staining around their teeth, very superficial staining that you can maybe air polish off, but their composites just look a bit tired and they look a bit matte and they don't look natural, and you want to get that shine, this is what we need to do. We need to get the orange and yellow Softlex discs on there. And notice how I'm using these discs. Okay, so as I'm pointing around the Softlex here, I'm following the anatomy lines. Okay, now I know I said that we're not going to polish away any composite or change any anatomy in the teeth. But it's a really good habit to have, and it really helps with how the light reflects off the teeth. So what you want to do is you want to polish around the labial buccal surface of the composite veneer without your disc touching on any of the anatomy lines, okay? Then you go on to the mesial and the distal side, angling it, not touching those primary lines there, anatomy angles, lines, and ensuring that you're cleaning around those areas smoothly and removing any superficial stain and encouraging a nice shine. Once everything is really nice and smooth, you then move on to, well, I then move on to my Lucida paste. Okay, so a little bit of Lucida paste on my glove. Now notice with the staffing, what we're doing here is we're using the edges of the wheel. Okay, so with the soft flex disc, we're flat, and I use the larger soft flex disc because they give a really nice flex when you're using them. With the Lucida polishing wheel, you're using the edges, and you're literally, again, same principles, okay? So we're going on the buccal surfaces, not crossing over onto those angles and those anatomy primary lines. And when we're doing the edges of the teeth, we are going interproximally. The staffing's really good at doing that. You could go right in between, and it helps remove some of that interproximal staining for you as well. You go right along the edges and angle through there as well. Notice I've got an obtugate in there, really handy to keep the lips and cheeks out of the way to ensure you don't catch the patient's lips and cheeks. Don't think a cotton wool roll is enough. So if you are doing this, I do recommend an obtugate in order to really get in there and give everything a nice buffer. Then I move on to my polishing wheels. So this is the EV rotary grey, which means that I'm not removing any composite again. And I dip it in some water first and then use my handpiece and angle it around, very similar to how we were using the Lucida wheel. And it washes away any paste that might be stuck in between the teeth, okay? And it just prevents the wheels from overheating as well, because you can be doing this for a few seconds, couple of minutes, and you don't want the wheels to overheat. And you could instantly see the reflection. Okay, obviously we used water on there, so it's going to look shinier, but they genuinely do buffer up and look shinier. You get rid of that matte look. But the important thing here is the reflection. So you want your composites to look as natural as enamel as possible, which has that really nice shiny reflection. So using these EV wheels really give it a nice pop at the end. And there's loads of different brands out there. Venus offers some, and I do have a Venus set in my other practice as well. So there's really loads of options with your polishing burrs, ladies and gents. Explore, find what works for you, find a system what works for you. If you have any questions of any of them, please feel free to reach out to me on social media. I'm always there to give you my opinion and what I find. But honestly, until you find what works in your hands and what system works for you, you're never going to really know. But I find that this system for me works great. Okay, so just very quickly, a little more science, because there's never enough science really. Do they give the same result? Yes, essentially. This is a study that was carried out in 2019. What was done is some composite was polished using a one gloss system, an enhance and pogo system, a stain buster system, and soft flex discs and wheels. And what they did is they looked at the enamel after they removed the composite under 200 times magnification. So they found that the stain buster, which is very similar to the enhance polishing wheels, very similar type of material, just a different brand. The stain buster left the smoothest surface on the enamel layer. And Softlex left the roughest surface on the enamel layer. And basically, when we dive deep into the science, we found that there was really not much in it. Okay, so all of them are all very safe to use, as long as you're using it correctly. But always follow manufacturer's instructions. Always reach out to your reps if you're unsure of what to do. Also, the sales websites, your Henry Scheins and all the rest of it, actually have like the manuals on there and loads of information of how to use it as well. So do have a look on there. But I thought that that was just an interesting study to show to you guys as well. Okay, air polishing. So I use air polishing for all my patients. Let's understand how air polishing works firstly. So air pressure controls the flow of the powder. Water pressure controls the flow of the water, and it's a controlled spray that propels particles, which provides an effective stream that removes biofilm and/or staining. Now, one thing to note is that whatever system you're using, I work across two practices. In one of my practices, I use the NSK Varios Combi Pro. In another practice, I use the EMS. Okay. Whatever you're using, it's very important to understand that the hand pieces, the way they're designed, water comes out of one part of your air polishing handpiece and powder comes out of a different part of your air polishing handpiece. And at some point, they meet. And that is the sweet spot of where you want your distance to be with your air polishing. Okay. Please check with your reps. There's loads of different systems out there. There's your NSKs, there's your EMSs, there's your Lunos, there's your woodpecker. Everyone would recommend different instructions. So reach out to your reps, find out what they recommend. I personally keep mine 2 to 4 millimeters away from the tooth and at a 60-degree angle or so, angled down to the tooth away from the gingiva, even though we're using subgingival powders, which we'll get into in just a moment. So, which powder do I use? I use glycine with my NSK and I use erythritol with my EMS. Now, I know that the woodpecker unit also uses the EMS erythritol powder and it's encouraged to use that. I've trialed the woodpecker unit and found that I was getting a lot more powder than I did on my EMS unit. And the appointment itself was a little more cloudy, if you like. And I've heard that the Lunos with the trehalose, which is also a subgingival powder, is also very cloudy. And BA International have Tagatose as well. Okay, so there's loads of different powders out there, loads of different systems out there. Please make sure that you're using the correct powder for the correct systems and get your rep in, reach out. It's not difficult to find a rep nowadays and find out what's the best way to use your unit and how to look after your unit as well. So sub powders is what we are going to be focusing on, and that is perfectly safe to use on porcelain work, on crowns, on bridges. So this is your erythritols and your glycines. You could use it on your composites, you could use it on implants, you could use it subgingivally and supragingivally. You could use it on dentures to clean those and prostheses and periodontal treatment as well. Okay, super powder is that more abrasive powder. Particle sizes are a lot larger. You don't want to get that anywhere near dentine. You don't want to get that anywhere near cementum or on soft tissues or on any porcelain composite work because it will damage composite. Okay, right. Well, what does the evidence say about all of these powders? Okay, well, all surfaces of a restoration must be maintained and polished to reduce plaque stagnation. That's pretty common sense. We know that. We practice that every day. So we want to make sure that our composites are completely clear of staining as best as we can to prevent any further plaque retentive factors being added on apart from the fact that they've got a composite there. The extent of the surface composite damage is material dependent. So remember, we were talking about the different types of materials, and this is where we need to consider what materials we are using. You know, the shiny, smooth materials had the smaller filler contents, the larger surface materials, which if a patient is really clenching and grinding, we might want to use a venous pearl because it's got a lot more strength. So it's very much dependent, but that means that it might stain a little more. Sodium bicarbonate has a strong detrimental effect on composite surfaces, more so than glycine and erythritol. And at present, there is no advantage over using erythritol over glycine. Both of them have very similar particle sizes and both work great. I use both of those every day in my clinical practice, and they're honestly both work amazing. The lowest roughening of composite surfaces tested was obtained by air polishing with glycine for 5 seconds, and that was a study that was carried out in 2014. So as long as we're using our air polishing hand pieces with the correct powder and the correct technique, we shouldn't be harming our composites, and it's perfectly safe to use. Thank you very much for watching and joining me on a Thursday night so close to Christmas. I really, really appreciate it. We have your QR code on screen. If you're able to scan that QR code, please do, like Siobhan said, please do drop a message in the chat, an email to Siobhan if you can't get your CPD to load. There is a special 40% discount off NSK products with the code WIN1225 at checkout. So please feel free to have a little shop around on the NSK shop and use your discount code as well. Finally, a massive thank you to the NSK Ikigai team. I'm very fortunate to be part of this amazing team. A special shout out to absolutely everyone on the NSK Ikigai panel. They have been an amazing family I've been part of for a couple of years now, and I've enjoyed every minute. Please follow us on socials, on Instagram, on Facebook, and I will just go back and leave this QR code on screen for you guys to do your CPD. Thank you.
Oh, thank you so much, Ibs. That was really interesting. And
Thank you.
I love to see the practical, of putting the discs and so on.
Yeah. Yeah.
Just while we're chatting there, just to say the QR code is there. And I've also put a link into the chat if you prefer to go by the link. And there's quite a lot of you on. So just take your time. If it just might get bombarded if you all do it at once. So it will be ready in a few minutes. So Ibs, let me see. The questions are coming. So thank you, very informative. Can you give me your social media details, please?
Yeah, it's at Ibby Newman. So IBBYNUMAN on Instagram. So you could reach out to me on there. I'm also on Facebook as Ibrahim Newman. So either of those two, they're the main platforms that I use.
So at Ibby Newman is the Instagram. I know I was
Yeah,
tagging
I'll
you
pop it in the
minutes ago,
chat.
but will you put it in? Okay.
Yeah, I'll pop it in the chat.
And can we use airflow with calcium carbonate, NSK pearl for stains on composite?
No, that's a super gingival powder. No, you want to use the perio powder on the NSK system, the glycine based one. Flash pearl is quite abrasive. Only for enamel, that one.
Okay, let me just make sure that everybody can get this.
Just going to stop sharing for a moment and I'll put my details. I'll get the screen back up.
Zoe, can you see that link now? Well done. It'd be a fantastic webinar.
Thank you.
So I guess everybody looking for your social media posts now, but I know you're probably quite protective because I know you kind of are staff, don't you? And to do your presentations and so on. But you are going to look at doing some courses perhaps next year, and
That's correct. Yeah, I'd like to
people
get
could
some
come and shadow
hands-on.
you.
Yeah, I'd like to get some hands-on courses done in the next year, where we'll be welcoming people. So I am based in Brighton, so maybe you could have a nice sunny break while you're down here on the beach and fight off some of the seagulls and go from there.
Oh, that might be an idea, mightn't it? Tie in a little
Yeah,
holiday.
yeah,
How
little
do you
city break.
reduce interproximal stains?
So interproximal stains is a big one when it comes to composites, and you should always warn your patients that it's likely to happen. The best way I find is to really give it a good go with the air polishing powder first to see if you could lift it. Then when I was showing you the Lucida wheels with the Lucida paste, that's really nice to get a nice smooth contact. And then a fine composite polishing strip to go in between the teeth and gently alleviate some of the staining. It does take a long time and you need to move really slowly and keep checking with floss because you don't want to eliminate that contact point. You need to do it really gently and really slowly. And you really want to wrap that polishing strip right around the tooth where the staining is and gently do a saw action side to side to try alleviate some of that staining as best as you can. But air polishing, a good blast with the air polish tends to do the trick as well.
And can you clarify the glycine you can use on composite as NSK do soft pearl, which is glycine as well as the traditional perio powder?
Yeah, so the perio powder particles are smaller, so therefore they're
Mhm.
safer to use. Soft pearl is water soluble, but it is a super gingival powder, so you still want to just be using the soft pearl on enamel surfaces only.
Is that okay? Whoever asked that question? Yeah. How do I avoid contacts overlapping and how to correct between centrals?
How do you prevent contacts overlapping? I'm presuming you're talking about when placing composites. Um, so you want to make sure that you're isolating your composites well enough. So PTFE tape is what I use to isolate my composites when I'm placing. Um, the trick with PTFE tape is two things. Number one, do not use a very thick PTFE tape because that will cause composite to float over the PTFE tape and get your contacts to overlap. Number two, you want to make sure that there are no creases when you're placing your PTFE tape because again, the composite will float in and over those creases. Okay, that's the first step. Make sure your isolation is down to a T and just build your tooth up from there. So if you're doing freehand, you want to make sure that you build up your walls first by placing a bit of composite around there. And if you're doing injection mold, you want to make sure that your PTFE tape has no creases and is not too thick.
And how do you re-establish line angles?
Re-establishing line angles can be done quite easily, but it depends how far gone the composite is. So for example, you will be using a bit more of a coarse softlex. So the number one rule, pick up a pencil, okay? I've been doing this for 6 years. Still, when I'm polishing, I use a pencil. I draw my line angles to where I want them to be or where they should be. Then I get my softlex disc and I make sure that when I'm polishing my composite, I am not touching the lines I've just drawn on the composite. Okay, so I'm pushing the composite down, but not touching the lines. And then I go into the side with the softlex angled again and ensuring that I'm not touching the lines and push the lines either out or in, depending on where you want your line angles. Like Siobhan was saying, I'm definitely going to do a hands-on course in the new year where I could demonstrate this a lot easier. I do appreciate it's quite hard to explain over Zoom, But please do reach out if you have any further more questions.
What is the modified Mylar pull technique?
What is the modified? What was that? Sorry.
Mylar pull technique?
The modified Mylar pull technique, if I'm not wrong, refers to the Mylar strips that are used. It's something that I do not use personally. But yeah, I personally don't use the modified Mylar pull technique. I build up with isolating with PTFE tape, freehand or injection mold.
Is this available to watch on demand? It is in about 7 or 10 days. I'll certainly be watching it back myself as well to take some more notes. What matrix do you like for anterior composites?
Anterior composites matrix, like I said, if I'm doing a diastomer closure, I tend to use a clear cellulose strip and really shove it vertically down the gum. But most of the time I use PTFE tape. I do not isolate with matrix bands. I just use PTFE tape.
Excellent presentation. Thank you, Ibs. What should be used during a general clean if there is no airflow or polishing kits available? Is there a safe Profi polish?
Yes, there is. So please do check the Profi polishing paste that you're using, because they also do come in a fine, medium, and coarse. And if you look at the back, it most of the time tells you if it is a coarse one to not use on porcelain or on composites. So ensure that you're using the right polishing paste. And you could do that by checking manufacturer's instructions. And the ultrasonic scaler is perfectly safe to use around composites. That's a question I get all the time. Yes, perfectly safe to use as long as it's on the right setting and you're using it correctly. You're not going to harm the composites.
Lunos do an extra fine polishing paste that's really nice. It's the one that I'd probably used in general anyway if I was going to use a polishing paste. So that's an extra fine.
Okay.
What is the difference between deep Unica polish and when to use them? Unica proximal and when to use them?
What was that? Sorry. The deep polish. What was that?
The difference between deep Unica proximal and when to use them.
Deep Unica proximal. I'm not too sure what you're referring to there. Could you maybe rephrase the question for us?
Unica proximal matrix.
Oh, the Unica proximal matrix system. What's the difference between that and was that the question?
What's the difference? Maybe you could just is that what you're asking? Thank you so much, Ibrahim and Siobhan. Yes, they're asking. Yes.
What's the difference between, was it in question and answers? Is it all right if I just have a look at?
Yeah, I think I might have pressed on done by mistake. So sorry about that.
Oh, that's all right. I'll find it. How to contact overlapping. We've done that one. Unicoproximal matrix. What is the difference between deep unicoproximal and when to use them? So I'm not familiar with the unicoproximal matrix system. I'm not sure if you're referring to if there's a deep unicoproximal and when you need to use the deep unicoproximal, but my advice will be to definitely reach out to the reps or reach out on social media and see if they could get some answers, because I personally don't use the Unica system.
Okay. And I think we'll say thank you very much. I'll let you back to being daddy.
Yes, back to being daddy, yeah, on daddy duty.
Ibs, that was so helpful. Thank you so much, because
No worries.
we are bombarded at the moment and there's a lot of cases coming through and we do kind of come a little bit unstuck on, how to progress forward. So that, that's really helpful. I think we'll have to have you back again next year to really run through that. But I think definitely need to look at maybe doing a hands-on.
Yeah, absolutely.
Gulab's just saying, I think deep proximal is for subgingival cavity.
Okay.
And just thank you. And thank you. Great presentation. So I'm going to end it there. Happy
Thank you.
Christmas, Happy New Year
Yeah,
to you, Ibs, to everybody. Thank you for showing up to our webinars because while you keep turning up, we'll keep putting them on. And next year, we've got lots of content. We've got from January to June again with lots of perio and some of the core subjects. And of course, we have to do some well-being in January to look after ourselves. So, yeah, again, happy Christmas and New Year. Look after yourselves and take care. And we'll see you in 2026. Thank you.
happy Christmas and New Year, everyone. Thank you. Bye bye.